The elevator pitch in healthcare. Mastering the art of concise, compelling communication in high-stakes medical environments. What is it? What is the elevator pitch? What's the concept? The elevator pitch is a concise, compelling summary delivered in the time it takes to ride an elevator, hence the name. Typically 30 to 60 seconds or 75 to 150 words. Born in business contexts where entrepreneurs needed to capture investor attention during brief chance encounters, this communication strategy has become essential across professional settings, including healthcare, which is my focus at this time. But I would like to discuss the principles behind this way of communication. First of all, it has maximum impact. It provides or delivers essential information. It captures attention, and it leaves behind a memorable impression. So regarding the maximum impact, deliver critical information in minimum time without sacrificing clarity or persuasiveness. Because the idea of this elevator pitch, it's a sales pitch or a marketing pitch for a project or an idea that's related to a business. It's a business idea. And you are seeking some investors' help to invest in your project or to basically give you money. Okay? You need to leave some impression or impact on them after you are done talking. Essential information. Communicate key points without the opportunity for back and forth dialogue or clarification. This is a one-time opportunity for you. You met this important person, investor, by chance. And now it's your chance to tell them about what you have and present your proposal. Capture attention, create interest, and drive action from busy, distracted audiences who have limited bandwidth. This is important. This is essential because that's how we made the link between this business concept to healthcare. And finally, memorable impression, leaving a lasting impact that motivates the listener to take your desired next step. Okay, so what's the structure? How do we structure this concise form of communication? Every effective elevator pitch follows proven 4-part framework that guides listeners from initial attention through to action. Understanding this structure is the foundation for adapting it to clinical contexts. The hook: grab attention immediately with something unexpected, provocative, or directly relevant to the listener's interest. Number 2, present the problem or the context of your proposal. Establish relevance by clearly articulating the challenge or situation that matters to your audience. Number 3, solution. Now you have a solution. Present your main point, the answer, insight, or unique value you bring to to address the problem. So you presented the problem. Now this is the solution for the problem. So what do you want from me? The audience will say. The call to action, end with clear, specific request for what you want the listener to do next. This is the general structure for this pitch, elevator pitch. So why am I talking about this here in healthcare settings? I had this almost always continuous desire to try to borrow ideas from other industries and try to apply to healthcare to improve efficiency, to improve effectiveness, to streamline workflow, to do things that are proven in other industries like business, but some other industries like automotive, like these high HROs, basically, aviation, space, and all this. They have their own methods, structures that are very helpful and increases their productivity and efficiency. And these methods can be borrowed. They are good ideas. So can be borrowed to improve our efficiency in healthcare. And this has been done multiple times, but I like this idea. That's why I try to apply it for different fields in the healthcare system. And here I'm trying to relate it to communication. And communication in the busy daily work of the healthcare providers. So healthcare is fundamentally a high-stakes, time-constrained environment where elevator pitch principles apply constantly. Okay, remember the principles. The parallel isn't coincidental, it's structural. Clinical communication demands the same precision, brevity, and impact that elevator pitches require. Why healthcare is elevator pitch territory? Because attention is scarce, decisions are urgent, there is a state of information overload all the time. Hierarchy exists. I want to stop here. Junior team members must earn senior attention quickly and prove competence. So a hierarchy in a healthcare system is undeniable. Okay? There are junior, seniors, attendings, consultants, of all kinds of hierarchies exist in that workplace within the healthcare team. So communication between the different members of the team with their established hierarchies can be daunting. So you want to have a way of relaying your ideas in a way that grabs the attention of the other team member and make them want to help you, basically. And it's a sales pitch, as we said. It's a form of trying to sell your idea or to attempt to grab the attention of the other to help you or help your patient. Handoffs are brief. When you are required to hand off or to present handoffs to 20 plus patients, that needs to be very precise and concentrated and to the point. And stakes are high, of course. They are life or death. So that's why healthcare requires information transfer in a very concise and informative manner. Precise, concise, and impactful. So you have the one-liner, the purest clinical elevator pitch. The clinician or the clinical one-liner delivers maximum situational awareness in 10 to 15 seconds. It's used when you literally catch someone in the hallway and need immediate senior attention. This single sentence can determine whether the clinician stops to engage now or continues walking. Okay, example. 68-year-old male with hypertension, diabetes, and CAD, status for CABG, presents with crushing substernal chest pain radiating to the left arm for 2 hours. Why it is an elevator pitch? It satisfies all the criteria. Delivers complete clinical snapshot in under 15 seconds. So it's short and informative. Provides immediate situational awareness without extraneous detail. Allows senior clinician to instantly triage urgency and decide on engagement. It's attention grabbing. Front loads critical red flags. CAD, chest pain, that demands attention. Okay? Now, frameworks and models for communication already exist in different settings. One of them, the SBAR. Okay? The SBAR actually is used in communication when you are in an emergency situation or so to update the newcomers to the event. Okay? Clinical concerns into structural 60 to 90 second communication that drives urgent actions. It's the gold standard for conveying critical information to busy clinicians. So it's a very good way of communication between clinicians or all the healthcare team, actually. So SBAR stands for situation, background, assessment, and recommendation. And it's a very similar structure to the classical or traditional structure of the elevator pitch. Situation is basically the hook. Okay? I'm calling about Mrs. Johnson in room 412, who is having respiratory distress. This is an immediate hook. Everybody needs to have their antennas up. So that's why I'm interrupting you right now. This is the hook. Background, the context. She's post-op day 1 from hip replacement, has COPD, and was doing fine until 20 minutes ago. So this is a very emerging situation. The assessment, her O2 sat dropped from 95% to 88% on room air. She is tachypnic at 28, and I hear decreased breath sounds on the right. Okay? That's presenting the objective, what I think is happening based on objective data. So this is objective data presentation to whoever is listening to you, most likely a senior resident or an attending, and this gives them the full picture, basically. What do you want me to do? Now this is the ask. Okay? What I want you to do, the action. Recommendation, I think she may have a PE or a pneumothorax. Can you come evaluate her now? And should I start oxygen and get a chest X-ray? So he's asking for permission to do testing and to intervene, like putting her on oxygen, and at the same time asking you to come emergently or quickly to evaluate the patient. This is the ask. Okay. IPAS is another method of communication, and this is used during transitions of care or handoffs. So I'm not going to go through it, but it's the same idea. So we do have multiple communication models and frameworks existing in healthcare that are helpful and based on the same principles as an elevator pitch. Quick, precise, informative, and attention-grabbing. Okay? The same with the snaps, and here is basically the way we would like junior residents, interns, or medical students, or actually even seniors to present their case. That's what we want them to, how we want them to present it. And it's concise, it's well structured, it does prevent rambling and veering off from the during the presentation, which is a common habit for residents and interns. This is a 15-second safety elevator pitch. CUS stands for concerned and comfortable, and S is a safety issue. When a patient's safety hangs in the balance, you need to escalate concerns immediately. CUS provides 3 progressively stronger hooks designed to grab attention and stop unsafe actions. So concerned is the lowest level, maybe first level escalation. I'm concerned about this patient's blood pressure dropping. It opens a dialogue without triggering the defensiveness appropriate for early warning signs. Uncomfortable, second level, uncomfortable proceeding without another IV access. Stronger signal that sometimes needs to change before moving forward. And the last one is, this is a safety issue, we need to stop now. So this is like an escalating call to action based on how concerned you are. Now, let's just do one of these. The curbside consult. This is a real-world scenario. You catch a busy cardiologist walking down the hallway. You have one shot to get useful guidance. The difference between an effective and ineffective approach can determine whether you get the expert input or watch the consultant disappear. So let's see the bad approach. Hey, I have this patient, and he came in yesterday with chest pain, and he has diabetes, and his EKG shows. Wait, let me pull up his chart. Result? Cardiologist walks away. Too slow, unfocused, wasting precious time. That is not what we want from junior physicians in terms of communication. What is the good approach? How to transform this into an elevator pitch style that is really to the point, concise, informative, attention grabbing. Dr. Lee, 30 seconds on a STEMI case. That's a request. That's good. 55-year-old male, diabetic, crushing chest pain, 2 hours. EKG with 3 ST elevations, V2 to V4, troponin 2.5, cath lab activated, but asking about dual antiplatelet dosing in his renal dysfunction. Creatinine clearance is 35. Wow, I'm impressed. This is very objective, very clear, very concise. Cardiologist immediately knows if they can help and has enough information to give actionable guidance. So your ask was clear. You presented objective data in very short time, and your message and ask was clear. So excellent. In the previous example, the attention of the cardiologist was immediately grabbed. You managed to do that. Let's see this another scenario. You are paging the attending at 2 a.m. Usually not a good situation. They are groggy, possibly on call from home, and making a high-stakes decision with limited information. Your communication needs to be crystal clear. Okay. Bad approach. Hi, Dr. Martinez. Sorry to wake you up. We have this patient in room 507. He is here for pneumonia, but now his family is upset because, and you continue rambling. Nothing objective, talking about family being upset, nothing about the patient. You are just veering off. Buried lead. Unclear urgency, wasting time in tangential information while the attending tries to wake up and understand why you are calling. Nothing clear, nothing. You give no information. Let's see how this should go better. If we structured the response, made it concise, objective, to the point, with clear ask and clear information. Dr. Martinez, this is Sarah calling about John Doe in 507 with septic shock from pneumonia. His pressure dropped to 80/40, the spike 3 liters, lactate is 5, and he is on a max dose Levophed. I think he needs ICU transfer and possibly a vasopressin. Can you come assess now? Clear ask, clear presentation for the problem, objectively, okay, and very nice way of presenting. Why it works? Senior clinician immediately knows severity, context, and what decision needs to be made. No ambiguity, no wasted words. And this is another scenario, the rapid response. When you call a rapid response, the team arrives within minutes. They ask, what is going on? You have 30 seconds to paint a complete picture before you start intervening. They start intervening. This is the ultimate high pressure elevator pitch. Okay, this is an emergency situation, rapid response already called. The bad response, well, she was fine earlier, and then the nurse noticed. Vague timeline, no vitals, no assessment. Team has to interrupt repeatedly to get basic information. The good response should be either the MIST, or the SBAR hybrid. 82 female CHF patient, sudden dyspnea and confusion started 10 minminutes ago. very precise, vitals, blood pressure, 180 over 100, heart rate 130, respiratory rate 32, O2 saturation 85% on 2 liters, lungs with crackles bilaterally, just gave furosemide, 40 milligrams IV, put on high flow O2, now 90%. Thinking, flash pulmonary edema, need nitrogenous rain, and possibly BiPAP. Result? Complete picture in 30 seconds. Team can start acting immediately without hunting for basic information. That's how clear communication matters in these high-stake clinical settings. Okay? Let's see. Can you create your own personal elevator pitch? Of course. All these are suggested frames, but you can do your own. Beyond clinical scenarios, you need elevator pitches for professional advancement, interviews, networking, research explanations. The STAR framework provides a structure for non-clinical professional communication. That's another way of doing it. I'm not going to talk about this now, but the STAR method is a great method of communication. It's actually a storytelling structure or framework that's used during interviews and during other interactions that require structure and concise communication. What makes healthcare elevator pitches effective? Okay. First, lead with severity and urgency. Use standardized frameworks. The standardized frameworks actually are intended to cover different areas of the communication message that's needed in that situation. But the principles of elevator pitch, which is the conciseness, the impact, the necessary information, which should ideally be objective in nature, give me numbers, give me situation or description of what you are seeing, okay? They are applied to these frameworks. And we went through the SBAR, the IPAS, and all different forms. We have a lot of frameworks that we use during our daily communication, which even sometimes is written information, like the SOAP note. SOAP note is a form of communication, written communication between healthcare providers as well. Be specific, not vague, and with clear ask. That's essential, by the way. Okay, when a junior physician, resident, intern, student is talking to a senior physician and attending a consultant or any other senior, they need to be precise and they need to clarify what they need from them. Because why are you talking to me? You have to explain why. What you give me clear request or clear ask. Okay? It's a sales pitch. Remember that. This needs practice. This needs to be used consistently until it's part of you, part of what you do every day. So all these are actually frameworks that exist in healthcare, and they can be used in, as I mentioned, or as I showed, in different healthcare scenarios. And they are all based on the same principles as elevator pitch. Okay? So learn them, review them, see how you can use them in your daily work. That's the idea. So I think it's essential for people to know how to communicate in healthcare system. It's a high stakes industry with time constraint, information overload, and different team members with different levels of knowledge and expertise that you need to communicate with. Learning how to communicate is an essential skill in healthcare settings. And this is just part, being concise, to the point, clear, and with clear goals behind the message. That's one way of communicating in quick, urgent situations or any other situation that requires summarizing rather than detailing, because other situations can require elaborating on a subject or being detailed in your communication. Try to create your own, try to apply these elevator pitch principles to your communication every day, and you will see the difference of how people respond to you and how your confidence will go up. See you in the next video.